Mr. Knoll, are we on?
No, sir. I have camera issues here. Let me see what we got.
Is this on Facebook? Because I can try to watch it on my
Yes,
phone.
it is. Yes, it is. That's
And
what I'm
then I
looking
can
at.
tell you if it's on or not.
I don't see it.
I know you're there.
Camera issues here.
Is it on, Bob?
I can see you.
Okay.
All right, well, we'll go ahead and get started. Good afternoon, ladies and gentlemen, and welcome to this Monday, February 1st, 2021 public meeting of the Board of Garrett County Commissioners. I want to welcome everybody and thank you for tuning in. Everybody got a copy, I'll call this meeting to order. Everybody got a copy of the agenda in advance of the meeting. Mr. Knoll, are there any additions, deletions, corrections to the agenda?
No, sir, there are not.
Hearing none, do we have a motion to approve the agenda?
So move.
We have a second?
Second.
Motion and a second. The agenda is approved by mutual consent. Everybody got a copy of the minutes in advance of the meeting. Are there any questions, additions, or corrections to the minutes? Hearing none, do we have a motion to approve the minutes?
Motion to approve.
We have a motion. We have a second.
Second.
Motion and a second. Minutes are approved by mutual consent. Not much on the agenda as far as items, but we do have, as we have the past couple of meetings or several meetings now, we're going to start off with Bob Stevens and Garrett County Health Department with the COVID-19 update with the vaccines. The vaccine out there now, Bob, I'm sure you have a lot to share, and I'll turn it over to you, sir.
Good afternoon, and thank you for allowing me to attend this meeting and to present where we are as a county. And because it's really important to get that information out and to be as transparent as possible. You know, I spoke, I think, 2 weeks ago, and since then we have a lot of positive things have happened. And I want to emphasize that. I'm going to show you some slides here in a moment to go over that. But one of the things I want to let people know is this is no time to let down our guard. That, you know, there are new variants, the South African strain of the COVID-19, which is much more contagious, has been found in the central part of Maryland, and it will eventually get here. So it's really important that we vaccinate as many people as possible, and we continue to fight the fight that we've been doing. And with that, if Mr. Knoll will let me share my screen here, I will try to show you some graphics as to where we are as a community. So let me try that. So I hope you can see the slide of the state of Maryland. Is that what's up?
Yes, sir.
Yes.
Okay, great. Well, as you can see this, this is a slide that shows you that we are in the orange kind of dreamsicle phase here. That's not a place where people wanted to be, or that's not a place where folks wanted to be in the summer. Everybody wanted to be in the green or the yellow, and we were in that yellow phase for 6 to 7 months. And then we quickly went to this red phase. And then in the last couple of weeks, we were the first county to go back into this orange phase under 25. And so this is the case rate per 100,000. And because our numbers are small, it doesn't take much for us to move up and down. For instance, if there would be a few cases that we would find, we could easily be have a higher case rate than Allegheny County. But we're glad of the position that we're in right now. This is our positivity rate, and right there is Garrett County. a few weeks ago, we had a positivity rate 2 weeks ago when I spoke to you of 14.9%. And if you look at this, there's nobody over, well, Caroline County, looks like they're over 11%, but we've come down significantly. And that's really important because this testing and the positivity rate tells us if there looks like there's going to be an outbreak or not. And so we're headed in the right direction going downhill. So that's very good news for us. We're not quite below the statewide average right now, or the statewide average for their percentage, which is 5.61, but we're getting there. So that's good. This, I know everybody wants to talk about vaccine. And before we get started, I know that there's a lot of people who have been concerned that Governor Hogan 2 weeks ago said that counties could go to phase 1C, and we were saying we're going to hold the line and we're going to stay in phase 1B. So I'm going to show you a few slides that show why we did that, and I think people will understand by looking at the hard data that we are doing the right thing. If you look at this slide, the most important thing is this percentage of population that's been vaccinated. And you can see that we're third in the state behind Talbot County and Worcester County. I think Talbot in particular, they have a lot of nursing homes there, and the nursing home population counts into this. Before we came on the call, I know one of you asked me if about people who we vaccinate and other that might come from somewhere else, or somebody lives in Garrett County and they get vaccinated in, let's say, in the Walmart in Cumberland, or they get vaccinated at the Cumberland Health Department. Would they show up? And that number does get tabulated. So the population, the percentage of the population is the total number of people that are residing within the county. And just so everyone knows that when you look at the second dose, we're not as far along on the second dose, but that's because the smaller counties did not get any of the Pfizer vaccine, which you only have 3 weeks in between doses, and it's also distributed a week before the Moderna vaccine. So some of these counties that are ahead on their second dose, we're going to lag behind by at least a week on most of those metrics. This shows you of the percentage of vaccines administered that we have received. And so it's a little bit confusing because you say, how can you give out 107% of the vaccine that you've received? Well, Maryland Department of Health, when they give us vaccine, they give us a given number of doses. And then 3 weeks later, they ship what you're supposed to give out as the second dose that's coming along. And so when we schedule our clinics, we overbooked a little bit. And so we're at 107%. That number will go down when we receive, because the denominator will go down when we receive more vaccine. So when we get 300 doses tomorrow, we'll go back down to 90% or something like that. I'm comfortable with being a little bit over that. Our fellow county that's well above that, I would be a little concerned that they might outrun their second doses and might not have enough second doses to give to people. But they may have a different strategy there. But I think being at 107, because people are thinking, are we getting the vaccine out? And we are, in fact, getting the vaccine out. And so that's really important. I'm showing this slide only because the governor and some of the news outlets have said the reason why the state of Maryland has been lagging behind some of the other states is because the counties can't get their acts together to get the vaccine out. And I just wanted to show you this because this shows you the percentage. When you looked at that previous slide, this is the amount of vaccine that we've given out through all the health departments in the state, 91% of the 200,000 doses that we've received. You can see that is higher then the hospitals, pharmacies, retail, or this other category. And the other category is National Institute of Health, the Maryland State Police, federally qualified health centers, and other groups like that. And as well as some of the nursing homes. So you can see that that's just not true when they say that the reason why the state has not gotten as much vaccine out is because of the locals. And you know, it's being pushed now to the retail end, and you know, they're lagging behind. So I'm not. That's all I'm going to say. You can make up your own mind with the metrics on that. So this is what I really wanted to get to show you this, and I can't see. Oh, there. Maybe I can move your pictures over here. You know what? I'm going to see if I can move it over here on this side. So we have vaccinated in Garrett County. When you look at this shows you the percentage. We can do this for every county in the state. And you can look at this is the number of people in this 40 to 49 age group who have not been vaccinated, and 8.3% have been vaccinated. So why do we have people in these categories? Well, these are all the people who are medical care workers, teachers, people who are in public safety. And so that's why this number's here. But what I want to point out is that we have held the line on saying that we wanted 75-year-olds and 85 plus to be vaccinated. When you look at the state of Maryland, the average for 85-year-olds is 20%. So the average county has only vaccinated 20% of their 85-year-olds. When it's the 75 to 84-year-olds, the average for other counties is 24%. They have not really reached out to that population yet. And we know that 2/3 of our people who have passed away and who end up in the hospital are in the 75 to 85, 75 and above population. So we've done a really good job with this. And so based on those metrics, we're at this point ready to move to this phase. And so people have said, why didn't you move to phase 1C earlier? Well, it's because if we would have done that, we know that those 75 and above would have most likely been crowded out by the people who are in this 1C population. So at this time, when we have clinics, and these are public health clinics by the health department, we're going to focus on the 1C, the priority with the group 1C, which is 65 and over. We will continue to vaccinate healthcare workers, nursing homes and staff, first responders and public safety, assisted living, adults who are over 75, and education and continuity of government groups. But we're going to add to that the 65 to 74-year-olds. And we're really happy that we're in that group. And because we've vaccinated so many more of the 75 to 85, 75 and above group, we think that we'll be able to move through that 65 to 74 group fairly quickly. However, you know, we still, for our vaccine clinics for the rest of this week are all booked at this time. But as soon as we open up those vaccine clinics, we expect that we will see 65 year olds and up to be vaccinated there. And so that's a good place to be. I'm gonna stop. If I can stop, how do I stop there? Stop sharing my screen right now. So that's where we are. We've been at the health department here. You know, we've worked with our leadership team to make sure that we are doing the right thing by the metrics. And I want to stand behind that to say, you know, we are getting the right people vaccinated. Hopefully we'll get more 75 and over to continue to receive the vaccination, because it's just really important to do that. And I would say I want to continue that it's still so important that everybody continues to wear face coverings. continue the social distancing. The new strain that is from South Africa, the studies that they've done, the lab studies has shown that the Moderna mRNA vaccine is effective on that South African strain, as well as the strain from Great Britain. But it's really important that we continue to really do everything we can as a community in order that we can keep our rates low and then get back to normal just as quickly as possible. And I do want to say that overwhelmingly, and I wish I had this number in front of me because I don't, but if somebody can look up the number of people who have received or who have been infected by COVID-19 and use that for the denominator and look at the percentage of people who have died, and it's going to be quite a high number. Of the first 4 million people who were vaccinated with the Moderna vaccine, there were 10 people that had anaphylactic shock. A lot of people say they don't want to get the vaccine because they're afraid of getting anaphylactic shock because they may have had that at some other time to a reaction to a vaccine. So there have only been 10 incidences, which is 1 in 400,000. And when you look at your chance of dying, you know, we just know in Garrett County that we've had less than 2,000 people who have contracted COVID, and we've had 56 people who have died. So your odds are so much better to get the vaccine than to wait. So with that, I'll ask you know, if anybody has any questions.
Hey, Bob, excuse me, Mr. Chairman, do you want to go first?
I was just going to ask if anybody had any
I'm
questions.
sorry, I'm all right.
Right ahead, sir.
So Bob, the Walmart, is that a separate allocation of doses from the state, or does that come from the allocation that you used to get? Or where do they get theirs from?
We all of the vaccine originally comes from the federal government, and so when it comes to the state allocates it. Since the end of December, what the state has been receiving is about 73,000 doses per week, and so they divide that up based on an allocation. And our allocation formula, when I've looked at the numbers, we get our fair share. We were receiving 600. The first week we received 600. Then as Mount Laurel Medical Center receives some vaccine and Walmart receives vaccine. Well, we're down to now receiving 300 doses. But I will say just a couple of things. Those doses that are given out by Mount Laurel or by Walmart, they can contribute to help to assisting us as far as getting the total population completed. You know, the state has wanted to have as many providers as possible be online, but right now it's like having you're making the stream be a mile wide and an inch deep, rather than 100 yards wide and 50 feet deep. So yeah, that does it come out of our allocation? You can draw your own conclusions, but we're still getting 600 in the community. Walmart's getting 200 of those.
Thank you.
Bob, in the news recently, the governor said he was going to deploy the National Guard to Western Maryland to help with the distribution of the vaccine. Have you heard anything in the planning in that? Is that also going to come out of our allocation? What can you tell us about that?
There are supposed to be 5 sites across the state of Maryland with the first deployment of the National Guard. The first 3 are to the center of the state, and that's going to happen at Six Flags and the Baltimore Convention Center as early as next week. And then they're looking at a place on the Eastern Shore in Southern Maryland and in Western Maryland. What I was told the site that they're looking at for Western Maryland is Hagerstown. And that's 2 hours away from us. That's of concern what that does is if they're able to give 10,000 doses a day, let's say through the National Guard, or even 1,000 doses a day, we can have people who may not fit into our priority group. They can drive to Hagerstown and get a vaccine. What I have been told is that it will not decrease the allocation that is coming directly to the county, which is, again, those 600 doses that we're receiving. So I think that they're anticipating receiving more vaccine from Johnson & Johnson and AstraZeneca and the others who are looking to get an emergency use authorization in the next few weeks.
And I want to go back just to clarify, and Commissioner Heimball brought this up, and so Garrett County consistently is getting 600 vaccines a week, give or take. That at one point went completely through the health department, but now the county is still getting 600 vaccines, but some of that's being spread out to other people who are able to distribute the vaccine. Is that accurate statement?
That is accurate. And I can say that probably 75% of the health departments in the state are upset, and they think they would like to vaccinate everybody because we could do it in a consistent manner and not whenever you divide it out, then it makes it a little harder to coordinate and have a consistent plan. But we do have a weekly meeting, and at the next meeting that's on Wednesday, everyone that's receiving vaccine in the county, which includes Garrett Regional Medical Center, Walmart, Mountain Laurel Medical Center, and the health department, will all be attending that meeting. And so our goal is to tell everybody, okay, we can do phase 1C, but if everybody stays over 65 and try to focus on that group before we go down to the next group, that would be my recommendation from a public health standpoint to really.
So Bob, Walmart, Dan, if I understand this correctly, operates completely independent of the health department. Is that right? They get an allocation, they make the appointments, they administer it. There's no direct coordination between the health department and Walmart in terms of who gets it or when the appointments are made or anything like that?
There is absolutely none. We're trying to get some coordination, but I can tell you that they knew what they were getting for the next 3 weeks before we knew what we were getting the next week. The state has remedied that because we've been upset about that and said you need, from a planning standpoint, we need to know what we're going to get on Monday morning before Saturday night at 9 p.m.
And Bob,
They've changed that.
That distribution to the other, to Walmart and the others, the health department had no say. Am I correct that came from somewhere other than right here? You didn't say, Walmart, you can have 200 doses, and Mount Laurel, you can have 100. That was all through the state out of our purview, correct?
That's correct.
And so you had this on a slide, but to bring it back to this conversation, because I've been asked by a couple of people, if people are getting a shot at Walmart or Mount Laurel or fill in the blank somewhere other than the health department, at the end of the day, after all the reconciliations are done with who got a shot, where, when, and how, that our data is accurate on how many county residents actually have been vaccinated. Back to your chart. You're confident in those numbers because of the way that you can reconcile the data. Is that correct?
Yeah. Yes. The state requires that all the health departments have to go through a certain data platform, but the other organizations must have that also. And it might not be that exact same thing, but in order to, if they receive the vaccine, they have to report out daily. And if they don't report out daily, then they may not, they'll be eliminated from that list. So that number does come up, but I'm sorry about that. So we have to, that was the National Guard right there calling about our testing clinic tomorrow, whether we're going to have it or not. so interrupted my thought, but the vaccine, we know, because it comes from the federal government, paid for by the federal government, shipped by the federal government, a lot of the resources to distribute it comes from the federal government. They've said that we cannot discriminate. Nobody can discriminate over who they give the vaccine to. But we at the health department have done everything we can to, if somebody registers and they're from outside of our jurisdiction, then we're going to provide it. But we've done everything we can to try to make sure that our residents are the ones that really get it first. And so, and I think that, again, the data is there to support that. But we do know that, Walmart, my understanding is that, people can register through a national data site. CVS may be coming online. When they come online, people are going to register across the state. And so, somebody could register at our CVS who lives on the Eastern Shore and drives all the way up here for a vaccine. We only advertise ours on our website. We don't put it on a statewide website.
So Bob, if somebody gets the first shot at Walmart then, or Mount Laurel or wherever, are they then, Walmart, for example, are they then responsible for scheduling that person for the second shot?
The person is to make every attempt to try to do that, but we also know that, there could be somebody that, that received a vaccine. For instance, here in one of the things that the hospital is doing in their subacute unit and some of their immunocompromised patients, they will give them the first dose, and they may end up coming to one of our clinics to get the second dose. And as long as we have the supplies, we'll do that.
Okay, just for clarification then, from as of now anyway, you get 300 doses a week. At some point, you open up the link online for people to make the appointment. You take appointments till you're filled up, and then you close it. Is that correct?
That's correct.
So tomorrow, you're already booked up with this week's allocation. Is that correct?
That's correct. We closed it last night.
So next week, when do you anticipate that the link will be available for people to make an appointment for the next 300 doses?
I would really rather not say, because if I say it's going to be Friday at 4, then I have to do it at Friday at 4. Maybe before that, since the state has made a commitment that they're going to give us 300 doses a week. And so we may be able to open those up sooner and try to get those in, but we want to make sure that everybody has a fair shot at that. And so the other thing, just to be clear, when we receive 300 doses a week, those are 300 new doses. We'll also probably be receiving that week 300 of the second doses.
That's a good point.
So that we don't get ahead of ourselves. And that was the one slide where I said we're at 107%.
Yeah.
Because we dipped into our second doses because we overbooked, and that's an okay thing to overbook as long as we don't consistently overbook.
And there is no plan at this point. This is my last question, I promise. There is no plan at this point to just go with the first shot and not hold the second shot in reserve.
No, there is no plan to do that.
Okay, thanks.
One other thing I should say is that we're very proud of the fact that we have not allowed any vaccine to spoil. Once you open a vial that has 10 shots in it, you have to use all 10. And so logistically, you can't put it in the refrigerator and let it wait until tomorrow. And so we put shots in people's arms, and at the end of our clinic, if we have two shots that are available, we're usually looking for somebody that maybe it's somebody who has been working in the clinic, or somebody that knows somebody that lives close by or whatever, but we call those people and say, you just won the lottery today. because we have one shot left, and somebody said you might be willing. But we're not going to let that spoil.
Great. And any other questions for Bob?
That's a lot of good information. Thank you.
Yeah, a lot of good stuff, Bob. Thanks for finding the time as always, and thanks for all that you continue to do.
Thank you.
All right, the next item on the agenda for today is some board appointments. The Garrett County Emergency Services Board, Mr. Knoll, what do you have for us?
Yes, sir. We have 3 reappointments to the Emergency Services Board. These are for 2-year terms. The first one is Lou Bustella, William Ingram, and George Sonny Vincent. All 3 have expressed their interest to serve another term. So with your approval, we can appoint them.
All right, any questions for Mr. Knoll on the Emergency Services Board appointments? Hearing none, do we have a motion to approve the recommended slate of appointments to the Garrett County Emergency Services Board?
So moved.
We have a motion, we have a second.
Second.
Motion is second. Question on the motion. All those in favor say aye.
Aye.
Opposed, motion carries. The last item of business on the public meeting agenda is for the Garrett County Agricultural Land Preservation District applications. Last meeting, if you recall, we had the public hearing on this. We received 0 comment in the comment period in relation to the applications for the land preservation districts. So at this time, I'll entertain a motion to approve the applications of Tom and Mary Rosser for 126.04 acres, Chester L. Yoder for 172.2 acres, and Stephen Margroff for 51.98 acres to the Agricultural Land Preservation District.
Make a motion that we approve all 3.
All right, we have a motion. We have a second.
Second.
Motion and second. Question on the motion. All those in favor say aye.
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 Opposed, motion carries. Just a couple of announcements. We did get a couple of comments at GC comments. I think we addressed the first one, and the second one was a invitation for us to attend something, which we'll get back with you on. So hopefully that addressed all of the questions that we received through there. Once again, if you have questions or comments,
It was 95.
us individually or send to GC comments, and we'll try to address those the best that we can. Also, the next scheduled public meeting will be Tuesday, February the 16th. Does anybody else have anything for the good of the order? Hearing nothing, do we have a motion to adjourn?
So moved.
This meeting's adjourned. Thank you very much.
Well, I guess that's it.
Let me make sure I get out of here.
See, Paul's still there.
Yeah.
Mr. Knoll, you're still live on Facebook.
Yep.